Another common problem that we address in the ear, nose, and throat clinic is sinus and nasal issues. And a lot of patients will come to clinic with problems with chronic sinusitis, which is typically defined by 3 weeks or more of pressure in their sinuses, oftentimes coupled with associated symptoms such as drainage, possibly cough. Usually I find that chronic sinusitis has some causative factors. In a subset of patients, allergy can lead into chronic sinus problems, and others, structural problems can lead into it, such as deviations of the septum, narrowed sinus openings. These can be identified with either a nasal endoscopy exam in clinic and possibly complemented with a CAT scan for further evaluation of the anatomy.
A CAT scan is a modality whereby we are able to see inside your body. It is very good for imaging the sinuses, as the sinuses are encased in bone. It shows bone quite nicely, as well as the interior of sinus cavities, for example. MRIs show soft tissue much better. We don't use it very often for sinus disease, as we are looking more into air-filled spaces encapsulated by bone. MRIs, for example, are excellent for looking at soft tissue tumors, brain tumors, brain tissue, and any other soft tissue in our body. For sinus disease, we don't typically use that modality as much. I just joined the Austin Surgical Hospital about a month ago, and I've just started working here. We have just started here at the Austin Surgical Hospital the Sinus Center of Excellence, which allows us to treat patients with sinus disease quite effectively in a multimodality type fashion. Sinusitis is a disease whereby an infection occurs within your sinus cavities, and there are 4 different sinus cavities within your body. There are 2 cheek sinuses, 2 forehead sinuses, 2 sinuses in between your eyes, which are called your ethmoid sinuses, and a sinus back in the back of your skull that's called your sphenoid sinus. Any of those sinuses can get infected with a bacteria that then causes the symptoms of sinusitis, which again are facial pain, headaches, discharge from your nose, and other ailments that you typically get when you have a, quote, sinus infection. Sinus disease is very prevalent here in Austin, many times due to the allergies that we have here that cause swelling in your nose that then blocks off the sinus cavities. When the sinus cavities get blocked off, we then are set up with a situation where you can get an actual sinus infection.
For our patients with chronic sinusitis, after we've done a detailed examination and gone through maximal medical management, including allergy evaluation, possibly testing, which we do in the clinic, they can be offered a procedure called balloon sinuplasty. Balloon sinuplasty is really an exciting new procedure, relatively new in Austin, where we go in and we dilate the sinus openings. The sinus openings communicate with the nose, and in people with chronic sinusitis, the openings become in more of a closed state, and the sinuses can't get air into them and thus become an unhealthy structure. If we can get the air back into the sinuses by inserting a balloon catheter, which goes into the nostril, into the sinus opening, gets inflated, thus dilating a closed off opening, and then the balloon catheter gets removed, that opening will stay open and patent over the years. It actually addresses both the lining of the sinus as well as the bone in one dilation, and thus makes a permanent change.
The nice thing with that is there's no cutting involved. There's no instrumentation that causes significant bleeding within the nose or anything like that with this therapy. And that's why a lot of times we are offering that at the outset, as it's very minimally invasive. The older therapies that we typically have done in the past involve us going in and actually cutting the sinus cavity open. And obviously that has a higher risk of scarring, bleeding, and pain. And so typically nowadays we are going more towards the non-invasive modalities.
Balloon sinuplasty can be used in 3 out of the 4 sinuses: the maxillary, the frontal, and the sphenoid sinus. For the ethmoid sinus, there is an implant that can be used. This is an example of what balloon sinuplasty procedure would look like for the frontal sinus. The balloon and guide wire is placed through a frontal catheter guide. The catheter guide with the additional equipment is placed into the nose and into the frontal sinus opening. Through this guide, a wire is inserted into the frontal sinus, which is the sinus of the forehead, and a balloon is then inflated across the natural opening of the frontal sinus. The balloon can then be inflated to a pressure, causing a filling of the balloon, which dilates the frontal sinus opening to approximately 5 to 7 millimeters. After this is done, the balloon is deflated and all of the equipment is removed from the patient.
Yeah, the downtime, the nice thing with a balloon sinuplasty is the downtime is very minimal. I've had lots of patients go back to work the next day. Unlike the traditional sinus surgery, whereas with that you're many times out for at least a week and you have a lot more pain, pressure, swelling, things like that that can be a problem in the recovery period. This hopefully is a one-time surgery. Success rates with balloon sinuplasty and for traditional sinus surgery is about 85 to 90%. So the vast majority of people get much better with one surgery. Obviously it does not fix allergies and other problems that can cause the sinus infections to start with, and so we try to keep that under excellent control as well in the post-operative period.